Hey guys, so I just want to say overall I really enjoyed everyone's case studies. I really enjoyed hearing about acute care settings again because right now I'm at a completely different setting from everybody. And Rachel Hands was really cool to hear because I don't feel like we had enough education on that in school, so it was really cool to see a real life case study. So I'm just going to comment about everyone's in regards to their questions. So I'm going to start with Rachel's. I really enjoyed your presentation. I think Hands is such a specialized field that many of us in school or even entry-level therapists are not really going to experience that, and the fact that you get to do one of your level 2s is awesome. I really enjoyed hearing about your case study. I think that your case study was really interesting just because there was that psychosocial factor with having that person be incarcerated, also that the major motivation factor for him was his daughter, so I think that's really important to bring into your therapy sessions. But in regards to your question, I think one of the most important things to focus on is definitely evidence-based practice, and I really enjoyed the fact that you took your assumption that, we can't necessarily stroke always, they do the most functional, they regain the most strength within the first year, but you still have to look at it going forward because he is coming back 2.5 years later, so you still have to focus on that, you still have to give him the best therapy you can. But in regards to he's not able to get to your facility easily, I think an important thing to look at is maybe talking to him about home health, seeing if there is someone who specializes in home health, who specializes in hands, who is a home health therapist. I'm sure there has to be at least one out there. You are also in a major city, which definitely helps. I also think another important thing is to do is see the patients at your clinic, if you can see if any of them do live close enough by him, where you can possibly introduce them, see if they can maybe carpool. Therapy definitely brings people together, especially your place where it is an open facility. I think that's great. You can have them sit next to each other, maybe they'll spark up a conversation, this way they can get to therapy together, and they both can make functional improvements and also reach their goals. Now, moving on to Natalie. I really enjoyed your presentation of Charlie. I also had similar patients like him when I was back at my first level 2, so that was awesome to hear essentially another case study like I had, so it was nice to go back to that acute care setting. So in regards to him, I think it's really important ethically to definitely discontinue services as soon as that they found out that he had a will where it said that he didn't want to have any further services. I think it's important to respect that. Also, that's part of our code of ethics. Autonomy says that the patient is able to discharge services at any time, so we have to respect that, and if that's his wishes, then that is his wishes. I do think it's also, from our perspective as therapists, definitely to make sure that we educate them on if this is what you discontinue services, this the potential things that can happen, just so that they understand what they are fully getting into. Also, I think another thing is important, due to his lack of nutrition because of his dysphagia, beneficence says you don't want to cause any harm. So with that, we are concerned for their well-being, and if they do want to terminate services because of that, because he can't, essentially 10 minutes a therapy session is not really going to make much improvements for him, and that's really because of his dysphagia and the lack of nutrition he is receiving, then I also think that's an appropriate time to discontinue services. Also, I just think in general, we have to take a step back and just think that, the client's wishes do come first. We are a client-centered profession, so if they want to discontinue, we discontinue. And lastly, Becca. This case study was really interesting to me. I can't believe that a hiatal hernia went from that to an upper extremity paresis. That was, it's absolutely horrible, but it was really cool to hear about it. It was really interesting to hear about a case study like that. So I think what we can do is we can definitely inform doctors on the rounds. We can tell them that they might need to have a psych consult. We always need to report back to the nurses what we heard or saw during our sessions to make sure that they're informed, because if they're also seeing it, then it needs to be addressed. And lastly, I think you always have to make sure you're educating the clients no matter what. You have to go in there, educate them on positioning, just so that they don't form contractures, and also just the role of OTs, why we're there, why you shouldn't refuse us, essentially. Overall, guys, I think everybody did a great job, and I really enjoyed hearing everyone's case studies. Good luck with fieldwork.